Hi Moment of Truth family, my name is Melissa. I'm one of the therapists here at Moment of Truth, and this is my patient today, Jocelyn. She's also one of our therapists. This video is going to just guide you through what an MFR session kind of looks like and a little bit of what MFR is. So typically we start out by assessing the patient and then we'll put our hands on the patient. So I'm going to have Jocelyn turn around for me. So we're going to look at posture, looking at shoulder height, how the head is tilted, maybe one direction or another. She's a little bit here to the left, her right. Left side is higher here. We're gonna put our hands on and see what hips are doing, hip height, seeing alignment throughout the whole body, what side maybe they're standing on leg-wise, if weight is forward or backward. So we're gonna check posturally and alignment. We might just kind of put one hand on top and see if there's an energetic pull within the system front to back, giving us a better idea of what might need to get worked on. I'm seeing a little bit of thickness or pull through her right side body here. So I'm going to have her lay on her stomach and kind of just show you MFR, our cross hand technique. So we have Jocelyn down, going to work kind of the tightness through her right side body here. So cross hand, we put our hands kind of in a cross pattern. You can place your hands just within the body itself. We like to be on skin, so I'm going to come under her shirt and just here at her hip, we're going to sink into the tissue. So we're sinking into that first barrier. We're feeling skin, we're feeling tissue, and we're just going to wait and sink, allowing her body to be aware of where my hands are, reminding patient to kind of let go, no thoughts, no thinking, allowing our patients to remember to feel within their system. So kind of just a quiet, slow, gentle approach, sinking in to that depth barrier. And once I feel like I'm into that depth barrier, I'm going to take my hands and let them kind of slide apart where I'm feeling that resistance. So I'm going to tug her apart, but within that depth barrier. So sink, 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 and then just open a little bit. And then we wait. And sometimes patient will notice a connection elsewhere. She might notice something happening in her left shoulder blade or one of her hips. Kind of that connected fascial piece, like a tangled sweater that has a snag in it and it's tugged at your hip, but you feel it up in your shoulder as tightness. So we're just going to allow that to soften. I feel my top hand coming toward me just slightly. A little bit of rotation happening. And allowing her to remember to feel. Are you noticing anything in your system?
I feel warmth and a little bit in my right glute.
Right glute. So when patients comment that they're noticing something elsewhere, I might switch and come to the next area of tightness or tension within their system. So sinking in there and allowing her body to soften here. So MFR being kind of a connected piece, body-mind connection with healing. So as therapists, we're sinking into patient, allowing them to guide us within their true healing. And then if a release happens, we might reposition, skin check again. We might kind of tap into system and see where else needs to get worked. I feel a little bit of something here, so that might be the next place to work on for Jocelyn. Typically we'll have them stand up and maybe see what they feel in their body. They might be noticing changes or warmth or tingling in kind of different areas as their tissue is being rehydrated. Feeling, we might look at their posture again, see where things are aligned, if there's any more tight spots. A lot of times we educate with self-treatment that I'm still seeing something kind of left shoulder blade, so that might be where she softens into the ball, as we've kind of educated patients to sink in and self-treat at home as part of their home program. How are you feeling right now?
I mean, I feel great every time I'm treated, so yeah. Can we do it again?
So just a simple idea of what cross-hand release is within myofascial release. Hope this video was a bit useful to you in understanding a little bit more of what we do here with myofascial release and what to expect within a session.